In vitro fertilization. In vitro fertilization, IVF, is a complex series of procedures used to help with fertility or prevent genetic problems and assist with the conception of a child. During IVF, mature eggs are collected from ovaries and fertilized by a sperm in a lab. Then the fertilized egg is transferred to a uterus. One full cycle of IVF takes about 3 weeks. Sometimes, these steps are split into different parts and the process can take longer. IVF is the most effective form of assisted reproductive technology. The procedure can be done using your own eggs and your partner's sperm. IVF may involve eggs, sperm, or embryos from a known or anonymous donor. In some cases, a gestational carrier, a woman who has an embryo implanted in her uterus, might be used. Your chances of having a healthy baby using IVF depends on many factors such as your age and the cause of infertility. In addition, IVF can be time-consuming, expensive, and invasive. If more than one embryo is transferred to your uterus, IVF can result in a pregnancy with more than one fetus, that is, multiple pregnancy. Why it's done. IVF is a treatment for infertility or genetic problems. If IVF is performed to treat infertility, you and your partner might be able to try less invasive treatment options before attempting IVF, including fertility drugs to increase production of eggs or intrauterine insemination, a procedure in which sperm are placed directly in your uterus near the time of ovulation. Sometimes, IVF is offered as a primary treatment for infertility in women over age 40. IVF can also be done if you have certain health conditions. For example, IVF may be an option if you or your partner has fallopian tube damage or blockage. Fallopian tube damage or blockage makes it difficult for an egg to be fertilized or for an embryo to travel to the uterus. Ovulation disorders. If ovulation is infrequent or absent, fewer eggs are available for fertilization. Endometriosis. Endometriosis occurs when the uterine tissue implants and grows outside of the uterus, often affecting the function of the ovaries, uterus, and fallopian tubes. Uterine fibroids. Fibroids are benign tumors in the wall of the uterus and are common in women in their 30s and 40s. Fibroids can interfere with implantation of the fertilized egg. Previous tubal sterilization or removal. If you've had a tubal ligation, a type of sterilization in which your fallopian tubes are cut or blocked to permanently prevent pregnancy, and want to conceive, IVF may be an alternative to tubal ligation reversal. Impaired sperm production or function. Below average sperm concentration, weak movement of sperm, that is, poor mobility, or abnormalities in sperm size and shape can make it difficult for sperm to fertilize an egg. If semen abnormalities are found, your partner might need to see a specialist to determine if there are correctable problems or underlying health concerns. Unexplained infertility. Unexplained infertility means no cause of infertility has been found despite evaluation for common causes. A genetic disorder. If you or your partner is at risk of passing on a genetic disorder to your child, you may be candidates for pre-implantation genetic testing, a procedure that involves IVF. After the eggs are harvested and fertilized, they are screened for certain genetic problems, although not all genetic problems can be found. Embryos that don't contain identified problems can be transferred to the uterus. Fertility preservation for cancer or other health conditions. If you're about to start cancer treatment, such as radiation or chemotherapy, that could harm your fertility. IVF for fertility preservation may be an option. Women can have eggs harvested from their ovaries and frozen in an unfertilized state, or the eggs can be fertilized and frozen as embryos for future use. Women who don't have a functional uterus or whom pregnancy poses a serious health risk might choose IVF using another person to carry the pregnancy, that is, gestational carrier. In this case, the woman's eggs are fertilized with sperm, but the resulting embryos are placed in the gestational carrier's uterus. Risks. Risks of IVF includes multiple birth. IVF increases the risk of multiple birth if more than one embryo is transferred to your uterus. A pregnancy with multiple fetuses carries a higher risk of early labor and low birth weight than pregnancy with a single fetus does. Premature delivery and low birth weight. Research suggests that IVF slightly increases the risk that the baby will be born early or with a low birth weight. Ovarian hyperstimulation syndrome. The use of injectable fertility drugs such as human chorionic gonadotropin (HCG) to induce ovulation can cause ovarian hyperstimulation syndrome, in which your ovaries become swollen and painful. Symptoms typically last a week and include mild abdominal pain, bloating, nausea, vomiting, and diarrhea. If you become pregnant, however, your symptoms might last several weeks. Rarely, it's possible to develop a more severe form of ovarian hyperstimulation syndrome that can also cause rapid weight gain and shortness of breath. Miscarriage. The rate of miscarriage for women who conceive using IVF with fresh embryos is similar to that of women who conceive naturally, about 15 to 25%, but the rate increases with maternal age. Egg retrieval procedure complications. Use of an aspirating needle to collect eggs could possibly cause bleeding, infection, or damage to the bowel, bladder, or a blood vessel. Risks are also associated with sedation and general anesthesia if used. Ectopic pregnancy. About 2% to 5% of women who use IVF will have an ectopic pregnancy. This is when the fertilized egg implants outside the uterus, usually in the fallopian tube. The fertilized egg can't survive outside the uterus, and there is no way to continue the pregnancy. Birth defects. The age of the mother is a primary risk factor in the development of birth defects, no matter how the child is conceived. More research is needed to determine whether babies conceived using IVF might be at increased risk of certain birth defects. Cancer. Although some early studies suggested that there may be a link between certain medications used to stimulate egg growth and the development of a specific type of ovarian tumor, more recent studies do not support these findings. There does not appear to be a significantly increased risk of breast, endometrial, cervical, or ovarian cancer after IVF. Stress. Use of IVF can be financially, physically, and emotionally draining. Support from counselors, family, and friends can help you and your partner through the ups and downs of infertility treatment.